Guys, welcome back to Reform. I'm sitting in the window here at 46 Murray, and I was just talking to Eric a little bit about so nice to see this place come back to life with people up and down the sidewalks. There's two gelato places on Murray. You have lineups at now, and it's just nice to see everyone up and about after such a long time in isolation. And the other thing I wanted to share with you guys is, it's been a very busy season for new people coming into the office over June, looking for help with back pain. I mean, back pain primarily, and neck pain second. I think those are the top two things that I've seen come out of this whole stress of isolation, postural stress, new ergonomics, homeschooling stress, like all the stuff that we've all lived through. So I just wanted to give you a little primer on back pain, how it happens, the mechanics behind it, how to tell if you have a muscle pain versus a joint pain. And I hope that helps you in your journey of getting healthy. And of course, share this with anybody you like. Ask me questions. I'm always here to answer them through Facebook Messenger or through the office email. But I mean, the first question that I'll ask anybody here, how do you know it's muscular versus spinal? And being a chiropractor, I look at spine as the number one source of pain, because in the spine, of course, you have bones and you have nerves. And, when you put those things together, bones put pressure on nerves and you're going to be in pain. Some of the more severe being like a sciatic, where a leg goes numb or a shoulder or arm goes numb because the nerves are compressed in the spine, and we know that well. But to pry apart muscle versus spine, it's not actually that difficult. If you think about it, you'll realize that, when you sit too long for at the office desk, for example, or let's say you're driving to Montreal and by the time you hit Calypso, you're stiff. Like you have muscular tension, stiffness. And what we know about muscular tension, stiffness, it's not necessarily pain that muscles give you, but it's that tense feeling or that stiff feeling. And the other really nice thing about muscular pain is it goes away very quickly. So stretching at home or like a yoga class, heat works really well. So that's why hot baths, hot tubs, work really well, and usually within a couple minutes to a couple hours of treating it right, like your muscular pain is gone. Muscular tension, spinal pain is something a little different. So when you start getting deeper stress, deeper tension that starts affecting your spine, obviously you start getting in pain because you're compressing nerves, okay? The three main reasons your brain gets pain signals are mechanically, something compresses. There's inflammation, so there's chemical receptors that'll fire off your pain nerves. And then there's thermal receptors, so hot, cold, and those actually tie in quite nicely with inflammation. So without getting too technical, those are the three reasons why your spine will send pain up to your brain, and you're gonna be like, hey, that's not just tension or stiffness. That's not muscles. I'm actually in pain. Your brain is awesome at delineating pain. And then, of course, pain means nerve, nerves means spine. Okay. So I hope I didn't lose anybody there. You can rewind and play it at 0.75 speed if you want to get that again. But I want to show you a little bit here on just the technical side of this. So this is a low back, but this would be the same in the middle back. This would be the same in the neck. You have lots of moving parts in here, spine. You have big nerves. So for example, when I spoke about sciatic, that's the nerves going down to the leg. If they get compressed, your foot can go numb. You can walk on a cane. You can actually lose leg function because of pressure on the sciatic nerve. But the other couple of things here, and sorry, I'm swinging back and forth like I was saying, it's like Blair Witch Project for filming some of our candid movies. But you also have a ton of nerves wrapped up in these little joints. And you have nerves wrapped all around the discs and these bones as well. So all of a sudden, when you start seeing a misalignment in the spine, you start compressing nerves in these joints. you're going to be in back pain, right? Going back to the 3 causes of pain, mechanically, you're going to put stress on some joints and nerves. I talked about chemically, you're going to get some inflammation. Inflammation brings heat, and now you have kind of all 3 things firing pain signals to your brain, and you can get quite debilitating pain out of a spine. So I just wanted to shoot this really quick clip today because there's been lots of pain walking into this office over the last month. We've already been able to help a ton of people. Looking forward to hearing your story and helping you as well. But when it comes to the spine, that's how you know you should get your spine examined, right? Because if your brain is actually in pain, it's getting pain signals, it's a very different thing than the muscular layer. So just to treat those 2 very differently, if you have pain, it's probably time to get an exam. So this may be a video for you if it helps you out in your journey to keep well and healthy. If you're not in pain right now and you're just watching this out of interest, share this with someone he may be interested in living a pain-free life, because it is possible. And so this is Martin at Reform signing off, telling someone 13 years in the Bayard market here in Ottawa now, and thrilled to see so many people out and about. But what I know from clinical experience over the last month, there's also a lot of people in this city who are now struggling with painful spine and painful situations. And I know we can help you. So I hope you take this information to heart. Take care.